I'm Dave Duplay, and I'm here with Nathan Cherney. We're going to talk about palliative care, and Nathan, some of the great work you're doing around the integrated centers with the ESMO designation. I'm interested in hearing a little bit about what you're doing and how you've come about developing that program.
We recognized that there was a problem with the diffusion of palliative medicine into the practice of medical oncology, and we sought practical ways to overcome some of these diffusion barriers to try to get much greater penetration. And our plan was to develop a program which incentivized the integration of palliative care into oncology, and at the same time which gave a very structured plan as to how to do it. In 1999, this is now a long time ago, we developed 13 criteria based on our experience at the Shaare Zedek Medical Center and the guidelines of the WHO, and we agreed that any center meeting each and all of these 13 criteria would be able to receive ESMO designation as a center demonstrating a high level of integration of oncology and palliative care. Since the start of the program, we now have almost 200 centers around the world which are designated centers. This is a critical mass. We're now in a situation where you can say that if you're not part of us, then or part of this program, it challenges centers to say, well, what am I doing and how can I become part of it?
I'm also interested, Nathan, how do we let patients know about this program? Because if a patient has an opportunity to choose between institutions, how do we make sure that that patient gets to the right institution with your program?
Well, I think that patients. I think there's a global process of patient education. Patients want to receive the best of anti-cancer care to try to give them the best quality of life and the greatest chance of survival as long as they can. They're often not aware that they're also going to need care focusing on their quality of life, quality of coping, with a strong emphasis on support and communication. Now, one of the ways we've tried to address this is by preparing a handbook for patients called A Guide for Patients with Advanced Cancer, which is now available online in 12 different languages. And this handbook really gives people the questions to ask of their doctor, the sorts of things that they can anticipate. It addresses the sorts of issues they're likely to be dealing with, and it provides a very, very practical guide, both to work with the healthcare system and to ask the appropriate questions.
Nathan, thank you very much for joining us. You're doing a great job, and keep up the good work. Thank you.